breast cancer is the #1 cancer that affects women, and because of this, we tend to associate breast cancer with women. You're a man and you have found a breast lump. You may be wondering what to do about it. Should you get it checked or should you ignore it? Can men get affected by breast cancer? This is an area that we don't talk about very much, and so I thought I will delve deeper into the topic of male breast cancer. Breast cancer is less common in men. It represents less than 1% of all cancers in men and less than 1% of all breast cancers. In the UK, we see roughly just shy of 400 new cases per year, with a lifetime risk of 1 in 870. So you can compare this to the number that is 55,000 new cases of female breast cancer per year in the UK, with a lifetime risk of 1 in 8. So first of all, let's talk about risk factors. The first risk factor I would say is increasing age. The risk of any cancer developing increases as we get older, and this applies to male breast cancer. Second risk factor is ethnicity, and the risk factor of breast cancer in black men is greater than white men. Black men also have poorer prognostic features such as larger tumours, axillary lymph node positivity, and higher grade tumours compared to white men. We don't really know the reasons behind this at the moment, and so research is continuing. Family history, again, is also a risk factor, and interestingly, the correlation is stronger for men who report a sister alone compared to if a mother alone had breast cancer. However, the risk of breast cancer increases about tenfold if both mother and sister have had breast cancer. If you're a man and you have a BRCA2 gene mutation, then you have an increased risk of breast cancer with a lifetime risk of about 5 to 10% compared to the general population risk, which is low at 0.1%. Radiation is also known to increase male breast cancer risk. At the end of World War II in 1945, America detonated 2 atomic bombs, one in Hiroshima and the other in Nagasaki. And these 2 bombings killed at least 129,000 people. The most robust evidence that increased radiation exposure is a risk factor for men came from studies of the atomic bomb survivors. A cohort of just under 46,000 men were followed between 1958 and 1998, and it was found that the rate of breast cancer in these men increased during this period. And lastly, liver disease and obesity. So we know that conditions such as liver cirrhosis and obesity increases the risk of breast cancer. Men with a BMI or body mass index of greater than 30 have an 80% increased risk compared to men with a BMI of less than 25. So how does male breast cancer present? Well, actually, the symptoms are similar to that in women. So it normally presents as a painless lump, usually behind the nipple area, although of course it can occur anywhere in the breast. Men also have a condition called gynecomastia, which is quite common, and this is a benign condition that also usually presents as a lump behind the nipple area. And so it's very, very important for us to be able to distinguish between whether this lump is a cancer or whether it is simply gynecomastia. So how do we treat male breast cancer? Well, unfortunately, there are no randomized control studies specifically targeted towards male breast cancer. Therefore, we treat male breast cancer as we would female breast cancer, and that involves surgery, chemotherapy, radiotherapy, and endocrine treatment, depending on that patient's cancer type. Now let's talk about prognosis. Well, the American Surveillance Epidemiology and End Results Registry database suggests that men have poorer survival for stages 1, 2, and 3 compared to women. However, the relative survival rates, which is obtained after we adjust for older age at diagnosis and poorer life expectancy, shows survival rates are quite similar between men and women. So there it is, male breast cancer in summary. I hope you have enjoyed this episode, and I'll see you in the next one.